Hey everyone, welcome back to the channel. Today's video covers an important and surprisingly little known issue that could affect anyone taking GLP-1 medications like Ozempic, Wegovy, Mounjaro, or Zepbound, to name a few. If you're on one of these medications for weight loss or diabetes and you're scheduled for a medical scan, specifically a PET-CT scan for cancer or inflammation, this is something you really need to know. New research presented at the 2025 European Association of Nuclear Medicine Conference has shown that GLP-1 medications can alter the results of FDG PET-CT scans, which are commonly used to detect cancer, inflammation, and other diseases. How? These medications can increase uptake of the radioactive tracer, not just in tumors, but also in muscle, heart tissue, and fat, especially brown fat, that can mimic cancer or inflammatory disease on the scan and potentially lead to misdiagnosis or unnecessary procedures. Let's back up for a second. An FDG PET-CT scan is a type of medical imaging that helps doctors find areas in the body that are using a lot of energy, typically tumors or sites of inflammation. Before the scan, you're injected with a small amount of radioactive glucose. Since cancer cells often use more glucose than normal cells, the scan highlights those hot spots. But here's the catch. GLP-1 medications also affect glucose metabolism in the body. That's their job. So when you're taking them, your muscles, heart, or fat tissue might also light up on the scan, even if there's no disease present. This means if doctors don't know you're on a GLP-1, they could mistake a normal medication effect for a cancer recurrence or spread. That could trigger extra scans, biopsies, or even unnecessary changes in treatment, not to mention the stress that comes with a possible cancer misdiagnosis. One of the researchers behind the study said they started investigating this issue after noticing unusual scan results in patients on GLP-1s. Turns out it's not rare, it's actually becoming more and more common. So, what should you do if you're on a GLP-1 and scheduled for a PET CT scan? Don't stop your medication unless your doctor tells you to. Right now, most experts, including those behind the study, do not recommend stopping GLP 1s before your scan. Instead, they urge healthcare providers and imaging teams to ask about medication history and make a note of GLP-1 use when interpreting results. Some countries, like Australia, have already updated their imaging guidance to account for this. If you're a patient, here's what you can do to protect yourself. Tell your doctor and imaging team you're taking a GLP-1 medication. You'll also want to ask if the scan you're getting might be affected by it. And don't forget to make sure your medication list is up to date and complete, even if it doesn't seem relevant. This is especially important for people getting scanned for cancer, inflammatory conditions, or if you're part of routine cancer follow ups. GLP-1 medications are powerful tools. They've helped countless people manage diabetes and lose weight, myself included. But like many new drugs, we're still learning about their effects. This latest finding is a great example of how something that works in one part of the body can unexpectedly influence another. So if you're scheduled for a PET-CT scan and you're taking Ozempic, Wegovy, Mounjaro, or Zepbound, or any other GLP-1 medication, even if it's a compound, make sure your healthcare team knows. It could save you time, it could save you stress, and it could save you unnecessary procedures. If you found this video to be helpful, please hit like, subscribe, and drop a comment below if you've had a scan while on a GLP-1. Anything strange show up in yours that was related to the medication? We'll keep covering topics like this to help you stay informed and take charge of your health. Thank you so much for watching today, and we'll see you in the next video.